What do you do when your medications for erectile dysfunction just aren't working? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to go over what your next step can be if the treatments you're using for ED aren't giving you the results you want. In an earlier video, we talked about how to properly use ED medications and avoid the most common mistakes people make when taking them. But if you're still having trouble, what are your options? Today, we'll walk through exactly that. What you can add to your current ED treatment to help achieve a stronger, firmer, more reliable erection. Erectile dysfunction is extremely common. It's estimated that by 2025, around 300 million men worldwide will be affected. So what exactly is ED? It's defined as the ongoing inability to get and keep an erection firm enough for sexual activity. Most of the time, when someone is dealing with erection issues, they're prescribed medication. These are called PDE5 inhibitors, such as sildenafil, tadalafil, or vardenafil, commonly known as Viagra, Cialis, or Levitra. They're designed to work on demand, meaning you take them before sexual activity. However, they don't always work for everyone. As I've mentioned before, it can sometimes take 6 to 8 attempts before you experience the full effect of these medications. Even then, they're only about 70 to 80% effective, which means 20 to 30% of men may not get the results they're hoping for. To quickly review, these medications work by slowing the breakdown of an enzyme called cyclic guanosine monophosphate, or cGMP. This molecule plays an important role in the erection process. While these drugs can help you achieve and maintain an erection, they don't actually fix the root cause of the problem. So before adding anything new to your treatment plan, the first step is to understand what's causing your erectile dysfunction and address it directly. What are the most common causes of ED? In many cases, it's related to blood flow or vascular issues. That means improving things like blood pressure, cholesterol levels, and managing conditions like diabetes is essential. Now, if these medications don't work, the next option often offered is something called an intracavernosal injection. This involves injecting medication directly into the penis to increase blood flow. These treatments can be very effective, but they do require injections. And understandably, that can feel intimidating for many men, and it's something a lot of people would prefer to avoid. So to help guide you, I reviewed research on combining other treatments with PDE5 inhibitors to help improve erection quality, making them stronger, firmer, and more reliable. First option, adding a daily dose of tadalafil along with your on-demand medication. This is actually my favorite combination approach because it helps maintain a steady increase in blood flow to the genital area, not just at specific moments. Think of it this way. At baseline, the penis is in a relatively low oxygen state. The only time it receives a boost in blood flow is during an erection. Under normal conditions, your body naturally maintains healthy blood flow and oxygen levels through nighttime erections, usually 3 to 5 times each night. But when erectile dysfunction develops, those nighttime erections often disappear. That means you're no longer getting consistent blood flow throughout the day and night, only when you attempt sexual activity using medication. By taking a daily medication, you help restore regular blood flow to the penis over a 24-hour period, especially during those spontaneous nighttime erections. This helps protect the tissue from damage caused by low oxygen levels. When the penis stays in a low oxygen state for too long, the tissue can begin to change. It may lose flexibility and elasticity, and in some cases, scar tissue, known as fibrosis, can develop. As I mentioned earlier, men with normal erectile function don't need this approach because their bodies already provide adequate nighttime erections and healthy blood flow naturally. So how effective is this combination? One study followed 180 men with erectile dysfunction. They were divided into 2 groups. One group took 5 milligrams of tadalafil daily, along with 50 milligrams of sildenafil when needed, while the other group took only 5 milligrams of tadalafil daily over a 12-week period. The results showed that both groups experienced similar improvements in erectile function based on standardized questionnaires. However, the combination therapy provided better results for men with more severe erectile dysfunction. And that's an important takeaway. If your ED is more severe, you're more likely to see limited results from on-demand medication alone. In those cases, This combination can be a strong next step before considering more invasive treatments. Another study focused on men who did not respond to on-demand medications alone. So this applies to a specific group of men. In this approach, they were treated with tadalafil taken as needed, along with a daily dose of tadalafil. The daily amount was 5 milligrams, and on top of that, they could take either 10 or 20 milligrams when needed over a 12-week period. What the researchers found was that combining daily tadalafil with the on-demand dose significantly improved erectile function compared to using tadalafil only when needed. Finally, in another study involving men who did not respond to on-demand medications, participants were offered a different approach. They were asked to take 20 milligrams of tadalafil every other day, or 20 milligrams of vardenafil daily for 2 weeks. Instead of a lower daily dose, they used a higher dose either every day or every other day. The results showed that about 11% of men in the tadalafil group and 18% in the vardenafil group were then able to achieve erections. These aren't huge numbers, but if you're struggling and not getting the results you want, this can still be a helpful option to consider. Next, number 2, adding testosterone replacement therapy. The idea behind this approach is that low testosterone, also known as androgen deficiency, can contribute to erectile dysfunction. In theory, combining testosterone therapy with ED medications might create a stronger or synergistic effect. However, 3 randomized controlled trials looking at this question found no significant improvement in erectile function when testosterone therapy was added to standard ED medications, compared to using ED medications alone. It's important to note that these studies included men with normal testosterone levels, and they were relatively small. So, my expectation is that men who truly have low testosterone and symptoms that go along with it, including erectile dysfunction, may still see some benefit. This is especially true for improving nighttime erections, which help maintain healthy oxygen levels in penile tissue. That said, many men with low testosterone also have other contributing factors causing their erectile dysfunction, which is very common. In fact, only about 3 to 6% of men have low testosterone as the sole cause of ED. The bottom line is this: if you're dealing with erectile dysfunction, it's worth getting your testosterone levels checked to see whether testosterone replacement therapy might be appropriate for you. Next up, number 3, adding antioxidants. Now, I've talked about certain antioxidants before on this channel, especially L-arginine, so you can check out those videos for more detail. But both L-arginine and another antioxidant, propionyl L-carnitine, have shown some benefit in men dealing with erectile dysfunction. Let's briefly go over how they work. L-arginine is a building block for nitric oxide, and nitric oxide is what helps trigger an erection. Propionyl L-carnitine, on the other hand, acts as an antioxidant. Antioxidants help reduce the formation of reactive oxygen species. These are compounds that can break down nitric oxide. When that happens, it interferes with the process needed to maintain an erection. So by limiting those harmful compounds, antioxidants help nitric oxide stay active long enough to support erections. A systematic review looked at 9 different studies involving more than 300 men. In these studies, participants were given L-arginine in doses ranging from 2.5 to 5 grams per day, or propionyl L-carnitine at 2 grams per day, along with 50 or 100 milligrams of sildenafil taken as needed. Most of these studies showed noticeable improvements in erectile function. That said, many of these studies were short-term, lasting only about 8 to 12 weeks, and involved relatively small groups of participants. So we still need larger, long-term studies to know if this approach works consistently for everyone. Even so, adding L-arginine, or L-citrulline, which the body converts into L-arginine, or propionyl L-carnitine, may be a helpful option if you're not seeing the results you want. What about other combination therapies? In that same review, researchers also looked at PDE5 inhibitors combined with other treatments, such as metformin, folic acid, 5-alpha reductase inhibitors like finasteride, and angiotensin type 1 receptor blockers, which are often used to treat high blood pressure. Some of these combinations showed promising results, but again, the studies were very small. Because of that, it's not something I would broadly recommend at this time. I have discussed folic acid before on this channel, so you can watch that video for more details. The research there is also based on small groups, but one interesting finding stood out. Men who benefited the most from folic acid supplementation were those who already had low folic acid levels or a condition known as hyperhomocystinemia. These can be identified through blood tests that measure folic acid levels or check for something called the MTHFR gene variant. If you do have this condition, you might also notice symptoms like fatigue, dizziness, or sores in the mouth or on the tongue. Overall, it's reasonable to have your folic acid levels checked to see if supplementation could be helpful for you. Next, number 5, adding shockwave therapy. Now, I've created several videos explaining what shockwave therapy is and how well it works. In simple terms, it uses sound waves directed at the erectile tissue, creating tiny amounts of controlled stress. This triggers your body to release growth factors, which can help form new blood vessels and improve blood flow. But the key question is, does it improve erectile function when combined with medications like PDE5 inhibitors? To be fully transparent, I do offer shockwave therapy in my own practice, and I've seen meaningful improvements in men who aren't getting the best results from PDE5 inhibitors alone. That said, it's not just based on personal experience. There is research supporting it as well. A randomized controlled trial in 2020 looked at 922 men, with an average age of around 65, who developed erectile dysfunction after prostate surgery for cancer. These men were treated with daily tadalafil, along with 8 weekly sessions of shockwave therapy. The study found a significant improvement in erectile function. Of course, this isn't a perfect study. It doesn't represent every type of patient, and more research is still needed to fully understand how effective this treatment is across different groups of men. But overall, the results are encouraging, and it offers another option to try before moving on to more invasive treatments like injections or vacuum devices. And as always, take good care of yourself, because you're worth it.